Faith leaders are coming forward now with a new idea that they hope could help our African American communities recover from the virus.
And the statistics are troubling, to say the least. African Americans making up 39% of all of the cases in North Carolina and 36% of the deaths, accounting for just 21%, though, of the entire state population. Channel 9's Genevieve Curtis explains the new plan.
The NAACP is calling on the state to create a specific COVID-19 civil rights recovery office that would focus on the financial, health, economic, and justice needs as this virus continues to disproportionately affect the African American community.
My stomach has been tied up in knots with how we've been dancing around the many issues that we presently face.
To address the economic hardships, the plan details the need to offer funding for minority-owned businesses. Leaders want the state to immediately suspend mortgage and rent payments. And they're calling on the governor and state leaders to raise the minimum wage and specifically the wage of essential workers by June.
Blacks are more likely to be in occupations where there's a greater risk of exposure to the coronavirus.
Leaders are calling for paid sick time and paid medical leave for frontline workers. The recovery plan urges the state to expand Medicaid to get people access to treatment and to address the pre-existing conditions that make the virus more deadly for African Americans in the first place.
We're trying to help people to live.
Faith leaders warn this does not just impact one community.
Sociologically and economically, the pandemic will find its way to hosts that have already been facing enormous inequality. Now, what the rest of society needs to know is that it will not stay in those communities. So unless we close the inequalities, we are all at risk.
Now, I was scheduled to speak with a leader with the Department of Health and Human Services earlier today to talk about what the state is doing to address these disparities. But unfortunately, at the very last minute, they had to cancel and reschedule our interview for next week. But what I can tell you is earlier this week, Dr. Mandy Cohen said the state is focused on setting up testing locations in areas that have not had access to health care before. Now, here in Charlotte, Atrium and Novant are already doing this. Both hospital groups also have committees that are focused on equity and diversity in the long term. They are pushing access to healthy food, affordable housing, and making sure that abuse victims have access to services and help. Back to you.